joining us to talk more about this, we have Dr. Francisco Helpe. He's a urologist with Houston Metro Urology. I always love having you on.
Thank you. So it's a pleasure to be here.
So tell everybody at home, we're going to be focusing on BPH. What is BPH exactly?
So BPH is a benign entity that affects the prostate gland in men, and what ends up happening is it makes it harder for men to urinate. This is something that we kind of joke with the guys that there's 3 certainties in life: taxes, death, and that your prostate will grow. It will not necessarily affect everyone, but to a certain extent it can have an impact on the urinary quality of life.
So how is BPH treated?
There's a number of different treatments. A lot of this is dependent on the intensity of your symptoms, your approach with your doctor, but typically these can range from diet changes, behavioral modifications, medications, minimum invasive modalities, and then when we have really, really large prostates, we sometimes have to go and do major surgery.
You also have green light laser therapy.
Correct.
Tell me about this.
So green light is one of the many tools that we have available nowadays. It's a great tool in the sense that it's an outpatient procedure. It's minimally invasive. It's actually ideal for men that have any sort of bleeding disorders because we can do this safely in a person that's anticoagulated. But the end result is basically to open up a wider channel along the urethra so the patient can urinate with less restriction.
And why is this an important option for men to have, would you say?
A number of reasons, because it's something that will be happening to a lot of men, particularly as they get older. So it's important to keep an eye on the function of their bladder, and as such, I always tell my patients, my main goal is protecting their bladder health.
Right.
And number 2, we always use this also as an opportunity to have a conversation with regards to prostate cancer screening.
Okay.
Even though BPH does not mean prostate cancer, it's one of those instances where we can address the topic of screening, which is a very important thing for men over the age of 50 or so.
How do we get our dads and the men in our lives to go to the doctor?
It just starts with a simple conversation. I would say if they are basically wanting to come and talk directly to us, otherwise, at the very least, have this conversation with your primary care physician, and then we go from there.
Yes, my husband had never seen so many doctors as when he married me. I'm like, you have a headache? We need to make sure everything's okay. So, ladies, let's take care of the fellas in our lives. Where can people go for more information and to book an appointment with you? So,
our website is hmutx.com. I'm part of a large group in town called Houston Metro Urology. Plenty of offices around town. More than happy to help out and spread the word.
I always like it because you make everybody feel comfortable. So I know that the guys will feel comfortable. I smile when I see that you're coming in. One of my favorite doctors in town for sure. Well, thank you so much, and happy early Father's Day to you.
Thank you.
Yes. So make sure you take care of all of the men in your life and make sure that they get this checked out. There are options for